Maybe you are suspecting to be pregnant, but you don't know the exact time to do the self-pregnancy test. That is the urine pregnancy test. You don't know after how many weeks, months, or even days that you're supposed to take the self-pregnancy test. If at all you are pregnant, when is the right time to do the pregnancy test for it to turn positive? Maybe you've done it and it has come out to be negative, and the way you are feeling, you feel you did it a bit earlier. Once again, greetings from Nurse Janet, and I take this opportunity to welcome you to the Nursing Moms. Nursing Moms is a space where we discuss maternal health, child health, or even any other nursing related topic or a concern. Actually, in this video here today, I'm going to share with you the recommended time to do a pregnancy test and the reasons why you should do a pregnancy test. If you are new to this channel, kindly hit the subscription button so that we move together as a family. First, we have to understand that the urine pregnancy test tests for a hormone known as the HCG. HCG in full means the human chorionic gonadotropin hormone. This hormone is only released after implantation, that is, after a fertilized egg has been implanted on the uterine wall. This is when this hormone is released into your system, and again it's excreted in your urine. This is why during pregnancy this hormone is present in the urine. And so, what is the recommended time to do a pregnancy test? First, it depends on your cycle. If you have a regular cycle can be having your menses after every 28 days. Then the first day after your missed period, if you are supposed to get it on day 9th, from day 10th onwards, you are supposed to take a pregnancy test to confirm whether you are pregnant or not. And if you have irregular cycle, then you are supposed to wait for about 1 to 2 weeks after missing your periods for you to take a self-pregnancy test. This is because in irregular cycle, there are several things that can delay your menses. And again, if you are not patient enough to wait for your periods, then you can take a pregnancy test 2 weeks after having unprotected sexual intercourse. Developing significant levels of HCG hormone in your body takes about 7 to 12 days after successful implantation. This means that after 7 to 12 days after successful implantation, this hormone is already in your system and it can be excreted in your urine. Another important question is, why should you do a pregnancy test? The reasons for doing a pregnancy test. Number 1 is missed periods. Actually, missing a period is the most reliable sign of pregnancy, and you are just about to confirm whether you are pregnant. There are several reasons why one would miss periods, but again, the number 1 thing that comes into your mind when you are a woman of reproductive age and you are not using any contraceptive, you've had unprotected sex, the first thing that comes into your mind is pregnancy, and this is the reason why you'd want to do a pregnancy test. Number 2 is having cramps. Actually, implantation cramping is almost the same as those menstrual cramps. If you've experienced cramping, then you thought that your periods was just about to come, and again it didn't come, okay, you are free to do a pregnancy test because most likely that was an implantation cramp. The important reason for doing a pregnancy test is the contraceptive failure. Apart from failure, we can have emergencies like a condom burst. If you had a busted condom, feel free to do a pregnancy test, most likely 2 weeks after such an incident. And again, all these contraceptives are not 100% effective. There's some percentage that always leads to failure. There is a failure rate percentage. And maybe you can be a victim of this small percentage of failure rate. So in any contraceptive, suppose you're feeling you are not okay or there is something that you are suspecting. Again, the 4th reason is if you're feeling different. Actually, there are several ways to diagnose when you are pregnant. It can be from nausea, fatigue, any other symptom that can trigger your mind or can show you that there is someone growing inside. Feel free to do a pregnancy test. And if you're doing the home pregnancy test, kindly use the early morning urine. Any other urine is okay, but again, the early morning urine is recommended because it has high levels of HCG in it.